The Minerals Council South Africa, in partnership with the National Prosecuting Authority, have launched a fund for gender-based violence response centres. This comes as government's latest crime statistics show double-digit percentage increases in murders, attempted murders and grievous bodily harm assaults against women between July and September this year, compared to the same period a year earlier. Dr. Thuthula Balfour, head of Health at Minerals Council South Africa, joins me now. Dr. Thuthula, thanks for your time this afternoon. Now, talk to us about what has necessitated this new partnership.
Thank you very much. As we are aware, in South Africa, there's very high rates of gender-based violence, and that also does translate to high levels of the same in peri-mining areas because mines are not separate from communities. And so it was felt that we need to make a contribution to ensuring that women do have access to services that will address all of their needs, the medical, the legal, the social needs that they have following gender-based violence to stop secondary victimization. And so that is why we felt that as the Minerals Council, we need to pitch in to support the NPA and to partner with the Gender-Based Violence Response Fund in the setting up of more Thuthula centers around the country, especially in the peri-mining areas.
Now, how do you expect this initiative to impact women and children in mining communities specifically?
As I said, gender-based violence is everywhere. And what we like about this model is that they have a very high conviction rate. If you've been to a Thuthula center, you get comprehensive services which ensure a conviction rate of about 76%. This is compared to if you did not go through a Thuthula center where then the general conviction rate for, GBVF is about 8%. So we believe that this is a great initiative. It will really, stop gender-based violence because there will be consequences, and therefore the more we have of consequences, then people will be deterred, from harming the vulnerable, which is the women and children.
Now, let's talk about the Thuthula care centres, and obviously this impact. You're talking about a conviction rate of 76%. I'd imagine that there's a lot that they're doing differently that is not being done when you go to the police station, to a SAPS police station, for instance, and you make a report. What is it that they do different?
They provide a one-stop center. So when you go there as a victim, you are examined by a doctor who is trained. You have got the social worker there. You have got the police there. You've got a legal person who's going to assist you in crafting your case and taking it through for prosecution, and many other services. If you need shelter, that is provided. And that is what is making the huge difference, that the person is not being sent from pillar to post, from the police station to a district surgeon. And so with that one-stop model, it makes a huge difference. And that's why we believe this model really needs to be replicated across the country, because then people will have justice, when they have had the GBV perpetrated against them.
I certainly agree with that. Now, is a focus on preventing GBV or arresting the perpetrators? I always battle with some of the processes in that there is so much attention that is focused on dealing with the perpetrators, but how about the prevention aspect?
You are quite right. The Thuthula centers means that something has happened already. And so we are saying this is secondary prevention that we are at. You are very right that we need to do more on the primary prevention, which is to stop the gender-based violence. And in the mining companies, there are programs for employees. And I think in time, there will be collaboration with organizations beyond the mines. But the key thing is ensuring that women are educated. In fact, it's not just women and men are educated about GBV. Women know how to report so that if, let's say, something is starting still at a level which is not very harmful, things like sexual harassment, for instance, a person can report very early that, I have got this person who is harassing me, and there are consequences for the person. So the primary level prevention is things like that, where there's clear access to reporting mechanisms, and it is very clear also that there are consequences. There is something that is done, which means the perpetrator will stop what they are doing. And so you are very right that there's a whole lot that needs to be done on the part of primary prevention of GBV.
Well, let's talk about figures. What is the rand value of the financial effort that is being put into all of this? And how will it all manifest? I mean, if we look at a Thuthula Center today or in a week's time versus a week ago before this intervention, what is it likely to look like?
I don't have a rand value of a total Thuthula Center. It could be 5 million, it could be 10. I am not sure. But what I'm aware of is in the past month, we have had about 3 companies that have, that they had committed to put up Thuthula centers, and they actually went and opened those centers. And some of them were new. Those areas had no services before. And in our launch yesterday, I think what was very, very heartening was how many companies came through to pledge that they will support a Thuthula center, which means it's a package. And those which did not, you found that maybe they said, we'll pledge R1 million, to this initiative, or another says it's R1 million every year for 3 years. There are various permutations. It's not only the big things. We say you can support a whole comprehensive Thuthula center, or you can support an existing center to make sure that it's got everything to, assist it in functioning properly. Or you can, the NPA is looking at a model of maybe mobile Thuthula centers, but there's also transport, simple things like people don't have transport. So there's very, very many ways in which people can support, and it depends on the company and the resources that it has.
And finally, Dr. Thuthula, I watched a clip where a woman spoke about having been violated as a 5 or 6 year old, or almost violated as a 5 or 6 year old, but she never spoke out against it. And another report that we covered last week talked about the numbers that we have currently, I think, are only a fraction of the actual incidents of gender-based violence. Only a fraction actually leave their homes and go and report. Now, for those of us that are parents or guardians, how do we see, what are some of the telltale signs that the little ones at home or those around us are going through some form of abuse, particularly gender-based?
Okay. You are very right. There's a lot of people who don't report, and there's many reasons they don't. I won't go into that. Some of the things you can look out for is changes in behavior in the child. A child maybe who was generally very happy, but they are now suddenly very subdued, or a child who starts sleeping. They can't sort of face the world. That's the way in which they are coping. They start sleeping, or they start becoming violent, or they misbehave in a way. So those are all it's mainly changes in the behavior that the child exhibits. Then you need to try and tease out what could have happened. And the key thing, of course, is at all times we need to make sure that our children know that we are safe spaces. And so even before there is any incident, we need to raise a child who knows they can go to you at any time and you will believe them. Because what then stops the child from coming is not knowing that you will believe them. So all the time, make sure your child knows that if you come to me with anything, I will believe you before, I start blaming you or saying there was something that you did wrong.
Now, I'd hope to end the interview now, but something else has actually crossed my mind. And we talk about the conviction rate, which is around 76%, which is phenomenally high. I'd like to imagine that with added resource coming into the fore, that these figures or targets are going to shift towards 80 or 90%. Do you have targets in mind? Are there any targets in place in dealing with this scourge?
I'm sure the NPA wants the highest targets, as in 100% of people who are violated do get justice, which means the people that perpetrated, the violence against them are punished. And so I don't have targets, but I think that 100% should be the target. We should be looking at how do we raise the current national standard of 8% conviction if you haven't gone through the Thuthula centers. And for the Thuthula centers to be saying, how do we get to the maximum? And the maximum is 100%.
Dr. Thuthula Balfour, Head of Health and Minerals Council, South Africa. Appreciate your time this afternoon.